Hanging in there. How are you?
Any better?
It's a little delayed. Oh yeah, that's much better.
Okay,
Yeah, I
cool.
can see you better, but it's a little delayed. This is my first time being a guest.
Yeah.
So fun, but I'm also like, yeah.
What's
Now I'm
happening?
like seeing all the technical difficulties from the from the other side.
Yeah,
Okay, but this is
the,
better. I can see you so much better now.
cool. I've had problems with some delay today. And
Yeah,
so if that's happening, I'll just make sure to stop talking for a minute and let it catch up.
cool.
So I feel like we have the like a flip-flopped hair of like the same quarantine hair version.
That's what's great about doing these. Is you only like, yeah, you don't can keep your pajama pants on, keep everything else.
And like blanket on the lap. Yeah.
Yeah. Uh,
How's it going over
Busy. Well,
there?
it's nice to see you.
You
It's
too.
We're hanging in there, It's feeling lucky to be healthy and live near nature and
Yes.
have somebody to be quarantined with. But yeah, I like miss my family and just sad, but I
Yeah.
don't think I don't know what people did before we had this. And I like to talk a lot of shit on social media, but then at the end of the day, like it's so nice to have a sense of community and especially around, new motherhood and conception and all of this, all of life, but
Yeah.
especially in the work you do. It's so great. So
Well, and that's the thing is I've been talking a lot about that with people is that had this happened even like 10 years ago,
yeah.
how much worse would it have been for all of us feeling so isolated? And now at
Yeah.
least we can have face-to-face interactions.
Yeah.
So,
It is. It's like it's such a delicate balance because I find like for me, I'm like I need to do less of this and more like going inward,
yes.
right? And I think that like we with everything that's new, we find the pendulum swings, right? And we go
Hmm.
extreme to one end, but I do think that there's so much value in being able to still have a sense of community right
Hmm.
now. And I'm so grateful for technology. I mean, I just especially if you're alone, right now,
Very much
being
so.
alone, it's a lot.
And I think you like me, like I don't mind being alone, but that, there's like a limit, right? And it's like now I want social interaction,
Yeah.
but
Yeah. Are
I've spent
you, where are you? What's like your
my
quarantine
boyfriend's
lifestyle?
Yeah, no, so my boyfriend and I are both here. He's actually been administering COVID tests for the last week for the county. Yeah, so he's in like the full, like
Oh my
basically
gosh.
hazmat
I didn't
garb.
even realize that. Yeah, because he works as a lifeguard, right? Is that
Yeah,
so
and
he's
I don't know if I totally have this right, so don't like hold me to this, but from what I understand, they've recalled like a bunch of people who are EMTs. And so they're participating actively and giving these social, like the drive up COVID tests. So they're like at those stations and giving
yeah.
them. And it sounds like they've got the operation pretty dialed, but it's still scary. I mean, they're having face to face contact all day,
Mm.
every day with people who are symptomatic, because that's the only
Yeah.
people who are getting the test, the people
Yeah.
who are having symptoms.
Wow.
So, yeah, we're basically kind of both doing the same thing. Like at the end of the day, it's like you come home, you like take off everything you've been wearing outside, like
Wow.
immediately shower, so we're trying not to,
Yeah.
really hard not to bring it in the home. So like we're
Yeah.
not passing it or becoming carriers, but it's definitely like not the norm.
Oh, man,
So,
I'm so sorry. Speaking of the disrobing,
yeah.
baby, I'm on the live, okay? Sorry. Speaking of derobing, very different. My boyfriend is not going to test people on the front line. He just went to the market, and so I could hear him knocking because we do like a full,
Yes.
yeah, like he strips at the door, we throw it in the laundry, he
Yep.
like runs in. But wow, I mean, I hope at least does he have the
Yes. He's like
masks and
full
stuff that
mask.
he's
Yeah,
okay, so he's
everything.
able to be protected. Oh man, I'm so grateful
Yeah.
for all of the healthcare workers and just people out there who are even like police officers, like all of
Yes.
these people who just don't have it's a luxury to be able to stay home. It really is
No,
and
absolutely.
be
And
well.
people who can should, think of it in that way because that's a great way of thinking of it is like if you don't have to go out, like take
Yeah.
that for what it is and be like feel grateful that you can be at home and be safe, and help
Yeah.
everybody.
Yeah,
But
absolutely.
so speaking of the being at home, I talked to Debbie. I don't know if I think you were on a talk at the
Yes.
same time this morning.
Yeah, I was, but I know Debbie, and she's so great, and I'm excited to go back and watch now or after because I know it saves you
Yes.
stories, right?
Yes. And, so we were talking this morning about somebody who's actively pregnant and is really pregnant. I mean, like any day is
Used
going to
to,
be
yeah.
going into labor. How she's had to make these really big pivots and shifts, and, how it's kind of a big, scary time. And part of what I wanted to talk with you about is your perspective as a birth worker. What's been happening with the new mamas that you're working with, and how are you guys working together to shift and pivot your right now?
Yeah. I mean, it's so hard. It's so much of what we do is hands-on and
Hmm.
intimate. And same with you. I mean, I'm curious to know how yours has changed as well, but I know that we really value that connection and that intimacy. Is the sound okay?
Oh yeah,
Is there any
absolutely.
just okay? Um, but for me, and every doula is doing it a little bit differently, but
Hmm.
for me, I feel really strongly about minimizing exposure to my clients. I mean,
Sure.
it's like my number one most important. And then also, because I am still supporting women in labor before they go to the hospital. I'm sure
Sure.
any of you know that doulas are not allowed in the hospital right now,
Right.
but I am still assisting home births
Okay.
and laboring at home. So with that, it's even more important for me to really, really minimize my risk. So I've moved all prenatal sessions to virtual,
Okay.
FaceTime, which I was at first kind of like, oh no, how are we going to do this? But it works. It,
Hmm.
like, I have to say, like, it, is it my preference? No. But
No.
again, thanks to technology, I'm able to connect face to face. And there's this part of me too that I think with this, my clients are more eager than ever to absorb the information,
Hmm.
and really like not pay attention, but just like, okay, the focus is there because they know that they're not going to have me in the hospital. Um,
Sure.
they're really like taking notes. And so that's kind of, I
Yeah.
think, a blessing. And I think that's happening all over in the birth world, right? Is all of a sudden
Hmm.
we're like, oh, wait, whether it's home birth, hospital birth, whatever, like, I think people are realizing like the more I know, the more power I have in a very
Sure.
uncontrollable situation. So that's something that I think is positive to hold on to. And I hope it's something that we hold on to when this is over going forth, is knowing how crucial this preparation for this time and around this work can be to our health. So that's how that's changed. I usually go and see my clients within a week of them giving birth. I'm not going to see
Yeah.
the babies. But again, just available virtual at all times. I've also added an extra session prenatally
Okay.
because I just think there's so much more to talk about right now.
Hmm.
And I think that we should be just dedicating a whole session on talking about managing stress and
Yeah.
feelings and questions around this. Birth already comes with a host of these questions and
Hmm.
concerns and worries and fears and excitements and all of that. And now I think it's just magnified. Um, and
Definitely.
then I'm also making myself available virtually. All my clients go to the hospital. So, that's a strange and new thing, and I'm not doing it full time
Okay.
because I just haven't found that to be necessary.
Yeah.
But I am just kind of like there at the phone when, the nurse comes in and asks a question, or um, just as questions arise, or at moments where they do need me.
Right. Giving them some advocacy and support kind of in the
Exactly.
moment.
Yeah. And so much of what I do on any given day is, I say I'm like the mirror, right? So I just kind of like hold this mirror up so people can ask questions and explore options and reflect back what they need for themselves, right?
Hmm.
And so in my work, I ask my clients a series of questions as well as answering them so that they can come to their best conclusion,
Sure.
or find their best path. And so that I think is still something that, I mean, I know something that's still coming up. Even without me there, I'm grateful to be able to have that connection so that we can talk through a lot of the choices that you do have.
Yeah, and that's, I think a lot of us need that, right? Is like when we're trying to go through these new experiences that we need somebody to kind of bounce ideas off of and
Yeah.
see like, is this something reasonable or am I being like totally crazy about this? And especially if you have somebody who's a resource who's been through this before, you know, it's really nice to have somebody just to chat, to talk to about it
Yeah.
because, you know, like you already said, birth and especially for first time parents is already full of a lot of anxieties and this just adds to it.
Yeah. And like, I mean, minimizing fear is important all the time. But right now, the providers have fear, the nurses have fear, right? I mean, usually it's another day at the office for them when
Right.
someone comes in for a birth. But now, you know, even as you're speaking for your own personal experience at home, like we're all in this heightened level of what does it mean to go to work now?
Right.
And I think being able to sift through where the nurses may be coming from their own fear. And, you know, I'm just in awe of them and so grateful for the work that they do. And I know the nurses most of the nurses that I get to work with here in Southern California have just, you know, they're just amazing, right? And selfless and so loving. But I do think that when problems arise, it comes from our own fear. And I'm not free of it either, but I think like really going in there being like, how can I make sure my provider isn't acting from a place of fear?
Sure.
Does that make sense? Like, and a certain amount of fear is obviously protecting us right now. But we
don't want that.
Yeah,
We don't want that changing it and making it so that we're not getting the care we need.
Exactly. Yeah. Or overreacting, right, to something. Right now, one of the things that has been a real big concern to me and something that breaks my heart is the possibility of being separated.
Yes, and Debbie and I were talking about that this morning.
And
is the sound still okay?
Yeah, I can hear you. Is there a sound on my end that's disruptive?
No, I'm just hearing myself.
Because my boyfriend just got in the shower and I'm like,
no. Completely fine. But that was something we were talking about with Debbie and how at least St. John's, which is where she's planning on giving birth, they now are doing quick COVID tests.
Okay.
But only for the mother. And so they're not able to do it for the doulas or the spouses because they just don't have enough. But that was something she was saying is that's one of her big anxieties right now.
Is being separated from her partner or from...
Oh, no, being separated from the baby.
Yeah.
Yeah. She doesn't love the partner either, but...
No, I mean, none of it's good, but they're two completely different, but also very similar issues. And again, that speaking of fear, right, that I think is a decision that is important to deal with case by case. And I do think that from my kind of understanding and research is how it's being dealt with. But I'm also reading articles of providers acting out of fear and just kind of, it's not that they're not giving the option because we always have an option, but they're not presenting it as an option.
Right. It's just not being well communicated.
Yeah. And I think that is just such an important, hopefully any of you who are watching and going into a hospital birth is just always knowing that you have an option no matter what is going on. And that option, my mom joined. Hey, Mom. that option is not always presented to us, right? Sometimes it's made to seem like something that is mandatory, and it's complicated because you're under hospital policies and stuff like that. But I think that individual case by case care is what the healthcare system needs to see more of. You know, and I don't know if she spoke of this, but what I'm also reading is if you don't have that immediate test result, there's like a 48-hour, turnaround. Exactly. And then in that case, you're again like in preventing a possible exposure. There are risks to not being together in that time, and of course,
the bonding.
Yes, skin to skin bonding, breastfeeding. We know that babies thrive when they're with their mothers. Yeah. They're just survival rates. They're ability to breastfeed, and just that there's an abundance of research that tells us how crucial that time is. And so, of course, you know, because we know so little about COVID-19 and the, you know, the risk to children and babies and mothers, like obviously all of this is in their best interest, but I do think we need to be careful of the consequences that come with, you know,
kind of being reactive.
reactions.
Yeah. And that is, I mean, it's such a normal thing. When people are fearful, they act reactively.
Yeah.
And from my perspective, you know, one of the benefits I see of having a doula with you in the hospital-based setting is to have somebody act as an advocate for you, and you might not be able to do it for yourself.
Yeah.
Whereas I think that a lot of partners now, you know, are going to have to really step up and be that person for their mama.
Absolutely. And that's in the birthing space, but in postpartum, most of the hospitals that I'm aware of, partners aren't allowed to stay.
Yeah, Debbie was saying they're saying 2 hours.
Yeah,
and then they
2
have to
hours.
go.
So that's,
Yeah.
you know, a time where then your, you know, partner advocate is now gone as well, but really leaning on this social media, or not social media, but FaceTime, right? Contacting whether it is your doula or your partner, having them present in the space. But also, yeah, I mean, it's a really great time to become informed and prepare to be your own advocate.
And that's something I tell my patients often, is that regardless of what they're seeing me for, whether it's somebody who's in the birth space or maybe like an orthopedic space, is making those informed decisions and really educating themselves, because so many people aren't, and then they get subpar care because they just kind of follow what they're told, which sometimes isn't the best thing for them as a person.
Yeah, it's so different. And in this article that I'll send to you, and if you want to share it,
that'd be great.
After, it was amazing piece. But at the end of the article, the mother says, you know, she wasn't presented with a choice, and so she was very traumatized from this separation that didn't need to happen, and she felt just completely disregarded as a human being.
Sure.
And at the end, you know, she does say, had I been given the choice and explained my options, I would have chosen to separate, which was so interesting, because I think, you know, she wasn't saying what you guys are doing are wrong. Like she was like, in like hindsight, doing my research, I understand the risk and I understand the benefit for me personally of separating, but to not present me with the information and the option took away my autonomy.
Right.
So it was at that end, I thought was like a really beautiful twist, where it wasn't saying like, don't separate, you know, keep potentially, you know, infected mothers with babies and risk their well-being. It was saying these are individuals with individual needs, and, you know, each parent is qualified to make decisions that are best for themselves and their children.
Definitely. Just give people options.
Yeah.
So in terms of, we talked about like stress management, and I'm going to walk with you for a minute. So I apologize. Of course, my phone decided it wants to die, so we're going to take a little tour of the charger. Oh yeah, we're going to take a tour of the charger. What are you working with your clients in terms of stress management and helping them to just stay calm during all of this?
It's a great question. You know, I think minimizing the news watching is important, right? Again, being informed, but taking space and a break from it. I'm really big on meditation, hypnobirthing, movement. You know, if you can walk around and get some physical energy out, we know that that's a great way to reduce stress. But if not, doing it at home, yoga. I got a mini trampoline. Right, like
those are awesome.
Just, you know, physically help with our stress and the fight or flight. Hypnobirthing, I think there's wonderful techniques in that. And then connecting with your baby. You know, I think there's in this time of stillness, we have an opportunity to, like we were saying before, go inward. And, you know, things I've been telling my clients to do is to take a moment and tell your baby, like, we're okay right now in this moment. We are safe, right? We're okay. There's nothing to worry about, and like the worry that I have has nothing to do with you. I think it's really
That's really
powerful to
powerful.
establish that connection, right? Because babies pick up on stress, they pick up on the worry. You know, everything from heart rate to the pace of our breathing, right? That's
Hmm.
all right here, located in our diaphragm, as you know, and work so closely
Yeah.
with. The baby's just right there. So really saying, you know, like it's a mom, you know, or dad, we might have moments of more fear than you might have been used to, but it's not because of you, you know,
Sure.
or you're going to be okay, or we're going to be okay. And so that's, I think, like on a more spiritual level, like that is a really beautiful tool that calms both the mom and baby,
Definitely.
and is useful and beyond birth and through the labor as well. What else? Yeah, just like trying to send them as many like hypnobirthing resources as possible.
Yeah.
And then these, I have to admit, for me, selfishly, have been so nice. And the home birth stories that I've been sharing almost daily have just reminded us that birth is never something we can control. Right now, again,
No.
it's like it's heightened, but this is in a way like not, and not to undermine the experience of people giving birth right now, because it is um,
Really
a whole
stressful.
next level, yes.
Yeah.
But you know, that birth is a rite of passage, and that, you know, there's a certain element of birth that always brings with it a deep sense of like of unknown,
Sure.
and surrender, and connecting with that and preparing for that and taking the opportunity to learn more about how you can ride those waves, and then
Hmm.
just trusting that, like, I think every baby is born at a certain time for a certain reason.
Sure.
And so
Kind
I
of
think,
when it was supposed to be coming.
right, and like we're all on this planet right now for a certain reason,
Hmm.
right? Like this is our time, this is our hardship, and there's, I think, like it's powerful, and also being like in awe of this like human being's choice to come in at this time and like hopefully bring us to a better place,
Yeah.
you know. And then also just keeping a reminder that at the end of this you have like the best treat, right? There's like
Right.
the greatest gift after, you know,
Hmm.
whatever that birth may entail, and
Right.
again, not undermining the trauma that can arise from
Hmm.
birth at this time, but knowing that, you know, there are so many resources and people to support you through whatever that healing has to look like after as well. So I
Definitely.
don't know, those are,
Do you have, if you wouldn't mind, after we get off the call, if you wouldn't mind
yeah,
sending me some of your favorite resources that I could share with people,
yes,
that would be
absolutely,
wonderful
yeah,
because, there's resources that obviously like I share, but, it's wonderful to just be compiling a list of things that people can be doing virtually
yeah,
right now. And just, I
absolutely.
want
And there's so
everyone,
many right now, sorry, no, just there's
oh,
such a
that's
great
okay.
time for that. There's like so many incredible free resources
Hmm.
right now.
And that is a nice thing for people just to still be able to feel connected. And that
Yeah,
was one of my reasons I think I'd explained to you before of why I wanted to start doing these talks with people, was to have people coming in and feeling that sense of connection and realizing that there are resources out there for them, maybe that they haven't heard of.
yeah,
And in this time with us being virtual, it's like I've got new patients, like I said earlier today, I have a new patient from Chicago. And it's kind of letting people realize that like this can be, people can be worldwide connected and be using
yeah,
resources that aren't just in our local areas to,
yeah,
to help them,
yeah,
through through this time frame. And it could be somebody who's a prenatal yoga instructor from San Francisco they really connect with, that maybe they wouldn't have found before, or
yeah,
whatever.
yeah, or a book or whatever. You know, I was talking to Ricky Lake yesterday, and
I saw.
you know, for the best, but you know, for so many people that work in this field, we're like, this conversation isn't really new, right? Like
No.
that film was made 13 years ago, and it
Mm.
really highlighted a lot of things that were not being handled in the best way, and a lot of like injustices, and again, choice, or you talk about autonomy and the healthcare system. And so it is a real opportunity, and I hope one of the things, the positives that come of this is, like you said, like a deeper connection and a deeper desire to learn.
Hmm.
and take control and take ownership of this experience and of our health.
Definitely.
Yeah.
And that's something that I know we both advocate a lot is we want people that we work with, our patients and clients, to be able to feel that empowerment for their health and to
Yeah.
be able to be self-advocates, because that's something that those informed choices are so important. And oftentimes we rely on other people telling us what to do and realize that we really need to listen to our own selves
Yeah.
and trust our gut instincts that like either this is or isn't right for us. And if we don't feel like it's right, for it to fight for what are my other choices and not just go along with it.
Yeah. Absolutely.
So do you there was something else I was going to ask you and I just had a mind blank. It'll come back to me as soon as I stop trying to think about
All
it. It
right.
always does. But in terms of hospital births, you do both hospital births and home deliveries, correct?
Yes. So
Okay.
I do more hospital births
Hmm.
than home births, but do
Okay.
both. You know, they're just more people have hospital births in
Have
our
you found that your hospital birth women have any of them been choosing to switch to home birth over this course?
It's a great question. And definitely one that's been coming up a lot.
I bet.
There has been, I think our initial reaction, not our, but like kind of the feeling I got was that
Hmm.
initially when this happened, everybody was like, oh, what is this home birth thing that people have been doing? But like I
Didn't choose.
completely turned away from because I was like,
Yeah.
that's not mine. And all of a sudden we're like, wait, that actually doesn't sound like a terrible idea.
Hmm.
And so talking about some of the positive takeaways, I think that is exciting, right?
Yeah.
If you are somebody who works in this field, I think, or has had a home birth or, you know, is familiar with home birth, you see how much positivity and autonomy and all of these, there's so many powerful, wonderful elements of home birth that we, I think, culturally misunderstand.
Hmm.
You know, I've been getting calls of people asking, like, do you get medical attention? Do you get an epidural? Like, we just think of, I think some people think of home birth as reckless, right? When actually
Right.
your care is
Dangerous.
like dangerous or reckless. Your care
Hmm.
is so thoughtful, so thorough, and you're in the hands of people who are highly trained to either detect a high risk situation or deal
Hmm.
with things that come up, you know, in before a transfer, in a transfer situation, or just things that they can deal with on themselves, right? They have Pitocin for hemorrhaging and, you know, can troubleshoot essentially any medical issue that comes up or pass off to the hospital.
Sure.
So that's been a big discussion, is like just educating people on what a midwife does, what you get in a home birth, but also knowing that it's not for everyone. And just
Right.
because, you know, yes, I see it as a wonderful option, and I have clients all the time who seek it out, you know, not when our hospitals are one of the scariest places to be right now.
Right.
But we also have to recognize a lot of people want an epidural, you know, and I work with clients all the time, right, that go in knowing they want an epidural, and that is
Hmm.
something you don't get at a home birth.
Sure.
Can you do it? I believe 100 million%. Like, I believe in every woman's ability to do it, but also if you don't want to have an unmedicated birth, then you shouldn't,
That's
right?
your
If that's
choice.
not what, yeah, that's your choice. So you don't get that at a home birth.
Hmm.
And then I also think, or I know culturally, hospital birth is the place we've been told our entire lives is the safest place to be.
Right.
For most of us, again, not all of us, but for a lot of us, we just kind of see ourselves birthing there and feel safe birthing there. And I do believe it requires a lot of work to undo that, or to
Hmm.
chisel away at some of these beliefs that we've been taught around birth. And I don't think it's necessarily safe to do that in a week, if
No,
that makes sense, right? So we know that if you're not going to feel safe at home, then the labor, you probably won't progress very well,
because you'll be
right?
too
You
uptight.
probably won't, yeah, and you probably won't
Yeah.
have an amazing relationship with your midwife, which is part of the
Hmm.
reason why home birth is so safe, is because they get to establish this, and I'm sure Haley will speak more of this as well, but you get to really establish this connection, where they get to know you and analyze, right, and detect any potential risk factor that would make a hospital safer. So I do think that there are certain risks in rushing to home birth without really checking in with what is best for you, and finding a provider in that short period of time is difficult. So it's complicated. It is not the solution, but yes, to really, in the, the long answer to your question is, I have been seeing a lot of talk about it and a lot of looking into it, but not a lot of changes being made, if that makes sense.
Yeah, because it's all just happening so fast. Like you said, it's almost too fast for people to make that big shift. You know,
Totally.
I was kind of thinking more along the lines of not necessarily people who are immediately looking to deliver,
down the line.
but like maybe they're pregnant now but looking to deliver in September. You know, we just don't
and
know where things are going to be.
And that's a great opportunity. And those for my clients who are due in the fall and summer, we've definitely been talking about that. And again, it's still, just because you have time still doesn't mean it might not be right for you. But those are the clients that I'm more interested in having that conversation with, because I think those are the cases where we're going to see a more successful home birth versus transfer, which is also, you know, transferring is never fun and never easy, right? It's always, it's usually not part of the plan. And the person who's transferred didn't want to give birth in the hospital. But right now, transferring is specifically difficult because the emergency rooms are not a safe place to be. And midwives are not allowed in the hospitals. So the midwife would normally come to the hospital to explain the care that they have received and communicate with the other medical staff. But now you're losing that middleman.
And that'd be an awfully hard thing to explain mid-labor, you know, if you didn't have that help.
Exactly. And look, hospital by hospital, it's different. There's ways around it. You can call on the phone. You can, you know, have your midwife on FaceTime. But also just understanding that, if transfer, it's a hard time to be giving birth anywhere. But home birth is a fantastic option. And I do hope that this time opens our minds and eyes and ears to some of the really beautiful and positive and healthy elements of a home birth.
Sure. And it might be kind of a new revolution of that. You know, people are exploring different care options that they didn't, that they didn't even a month ago consider. I mean, a month ago, we started doing virtual PT sessions. You know, insurance companies are just starting to recognize that as like an appropriate treatment plan for people, which is great that they're starting to come around to that. But had all this not happened, we wouldn't have started offering, you know, I mean, half my patients right now are virtual. And the ones that are coming in are the people who are absolutely medically essential. Like, you just had your knee replaced right before quarantine or had a rotator cuff repair, and you can't rehab that on your own. You know, those are the people that we're actually coming in to see, you know, but we're moving everybody to virtual as we can. And women, especially who are nearing birth, you know, manual therapies that I would generally be doing to help to make them comfortable, you know, we're now teaching their partners or themselves how to do this virtually, but do it to themselves. And that's, like, as you said earlier, that's great because it's getting more partner involvement and helping with people really being more empowered in their own care. But it's all new. And so, you know, I'm kind of curious to see what's going to happen to the home birth movement of, will we see later in this year, those numbers increase just because it's a new option people wouldn't have considered before.
And kind of seeing like, oh, the hospital, I mean, every other floor of the hospital is for somebody who is sick or, having surgery. And then there's this one floor of like non-illness, right? And so like, it actually makes perfect sense. And a lot of countries do have this model to separate the hospital and even keep them close, right? For those, you know, or there's obviously high risk situations for cesareans, all that, but birth is not an illness, and it'll be interesting if we start to see a separation.
Maybe more birth centers.
Birth centers, exactly, and realizing that it might not always be in our best interest to be in a hospital to give birth.
That'll be a fascinating thing to see that shift. So, are there any other major questions that are coming up with your clients right now, or anything other major kind of concerns or fears that you think we should speak to?
I mean, you brought up some really great questions. I would say if having, just don't be afraid to ask questions to your
Mm-hmm.
provider, to the hospital. I obviously am biased, but get a doula. I know that doulas aren't able to support you in the same way that they have in the past, but I'm like, that support, whatever it looks like right now, is so valuable now more than ever. So, again, it's like people are adjusting their rates and reconfiguring everything. And so it is a great time to just, I think, seek out that support, even if it's for a FaceTime or to help ask questions or process some of the things that might come up in this experience. I would definitely recommend that. And also knowing that if you do end up, wherever you give birth, if you end up in the hospital and you want to leave early, know that a low risk birth, or a relatively normal birth, that you can leave the hospital as soon as you want. Of course, you want to wait until your doctor and pediatrician have okayed that.
Mm-hmm.
But insurance will cover 2 nights for a first time mom, 4 nights after a cesarean. And,
Okay.
now I think if you can get home and get out of there, again, without,
Recover
if
at
you're not,
home.
yeah, and recover at home, like that can be in your best interest. Of course, depending on how the birth went or if there's any complications after, right, your risk factors, this is a conversation to have with your provider. But that's a question I'm getting a lot, and I know is one of the things that a lot of the major hospitals are starting to recommend, is actually leaving earlier. And
And that's great.
yeah, and then again, varies person to person, but laboring at home as long as possible. I would
Sure.
also recommend for, right, a low risk
Mm-hmm.
person, and to hire a doula for that is also of tremendous value, because we
Something like you're guessing, or I don't know when it's the right time. I think that
yeah,
that would be invaluable for people.
yeah, and so many first time parents get turned away at the hospital because they're like, you're too early. And it's just like
Go
not a
home.
time where you want to take an unnecessary trip
No.
through the hospital. So
Or
I
even
can
in the
see that there as
car,
well.
I mean, it's like no one wants to go
Yeah.
anywhere that they don't have to go.
Yeah.
Oh, oh
Um,
my
that's I think is so nice. And look, hopefully you have a community of friends and family who are really bummed to not be able to cuddle with your baby, but also
yeah.
want to be there for you and show support and show love. Put them to work, have them cook, and like send them
Yeah.
some videos on like healthy practices, washing your
Mhm.
hands, wearing gloves, and this and that. And cooked food is obviously just ideal. For the digestive system of a new mother anyway,
Mhm.
but set up a meal train for yourself, and ask those around you to, maybe there's the first 40 days through postpartum that is at a distance. And then they owe you all the baby cuddles in the world once this is over.
Mm-hmm.
But yeah. And then another a way to connect to, friends, family, people, your doula, your partner, people who you were hoping would be in the birth room or postpartum room.
Mm-hmm.
Either have all of them record an affirmation for you, right? Or like something, you got this, like keep going, whatever it is.
Yeah.
That you can play in the room, or having them write it on sticky notes that you can post around the room. Like, I feel like I have so many questions for you about your work,
Well,
which
let's
I
just flip
always
flop and
admire. Okay, we'll
so
do more because
I'd be
it's so
happy to
important.
anytime. And thank you very much. And the top it and was like tears just blown away. And
Isn't it
for
so great?
it's so great. And for people who haven't seen this movie, The Business of Being Born, you know, it I mean it if you're nervous about becoming a mother and going through that process, it was just such a beautiful movie. I mean, I was like,
Yeah.
this everyone should see this.
Yes, and that was something we talked about, which, I always recommend it to my clients and my clients
Mm.
in knowing what your body's capable of, and then knowing that you have a say, and that that the more you know, right, the better your chances of being able to advocate for yourself are. And I just think it's, for me, like, yes, there's very like upsetting elements of that film, but also my takeaway is it's so beautiful.
Yeah.
And yeah, just expose ourselves to truths that are inconvenient in order to
Mm-hmm.
grow. And
No,
that's what
and
it's all about. Like, that rite of passage is, you grow and learn from the difficulties that arise.
a couple of the things that I had not considered were, about how important some of the hormones that you experience as a woman during the process of
Yeah.
laboring